So we have switched to, as you can see, festive Christmas mode. And actually, what I want to talk about does feel sort of strangely festive because it is relevant to what happens over the Christmas period. And a lot of us are taking time off. One organisation where people don't really get time off over Christmas is the NHS. And I think a lot of us feel that what the Conservative Party have done to the NHS over the last X many years has been absolutely horrific. And we've sort of been holding out hope that once they're gone, there's an opportunity to save the NHS. And what's really frightening is that this week, Wes Streeting, the Labour shadow health minister, has been talking about what he would do with the NHS, and it's really scary. First of all, he describes the NHS as having gotten complacent. Like an organisation where 10% of jobs are empty, where wages have fallen in real terms for now years and years and years. People are working for wages that they know perfectly well they could in some cases double if they moved overseas. We've got nurses going to food banks. We've got people working shifts that are way, way, way longer. You know, not being on call no longer means you might get rung. It means you're gonna be there. The NHS is stretched past breaking point, and people in it are doing their very, very best. To describe them as complacent is just offensive. You know, especially coming from a party that can't even put their weight behind a ceasefire. Come on. But he's also said that NHS spending is becoming unsustainable. Now, first of all, what is actually unsustainable is having an NHS that is so understaffed, because when you don't deal with problems quickly and efficiently, guess what happens to health problems? They get worse. And in the meantime, people are unable to go out and work, people are unable to do stuff, and they need more support, and they end up costing the nation more. So in actual fact, not funding healthcare is unsustainable. And, you know, a GP's appointment early on can stop people ending up needing to be referred to a consultant and all that kind of thing, ending up in accident and emergency, ending up in situations which cost a lot more. Not having enough staff means that the NHS ends up sometimes relying on agency workers who cost a lot more. This is not like the way that we're spending money is unsustainable, but also if like the only thing that is unsustainable is not having enough healthcare, right? The only alternative to funding the NHS properly is no longer having a fully funded NHS. And that there is no way on earth that is more cost effective. The NHS is so efficient at purchasing healthcare and putting together healthcare, and it does such a better job than if you have to go and buy it yourself from for-profit companies. It is absolute madness. The alternative to funding the NHS at the level that it needs to be funded so that everyone gets free healthcare at the point of need, the alternative to that is letting people die and letting people suffer. And there's no value to that, you know, that there's not a price that I am willing to put on that. We need to spend whatever it takes. And the best way to keep costs down is to keep it all in-house and not let it be privatised off. Even bring in-house the things that are currently outsourced to for-profit companies, sold off to international interests. Even the research and stuff that we're doing, if we want drugs to cost less, let's develop them within the NHS. It's an incredible resource. It's something that is the envy of people around the world. It is ridiculous to suggest even for a second that doing that is unsustainable. It's the best way to provide healthcare, and it's the only way to sustainably provide healthcare. On the top of that, I have a little sort of personal story. I was talking to a friend of mine about them making a visit, an emergency visit to the hospital recently, and they got to the door, and even though they were very unwell, they were immediately ushered through a sort of metal detector gate, and a security guard went through their bag and checked their pockets, and they were like, you know, really, is this necessary? You know, they were unwell and they weren't comfortable doing this, and they just wanted to get to their appointment. And the security guard said, oh yeah, well there've been, you know, some assaults on staff, some attacks on staff, so we're checking everybody to make sure they don't have a weapon. And obviously that's horrific, and there's no justification for attacking healthcare staff. But also, we have to accept that the reason that this kind of thing is happening is because people are desperate. You know, people unable to access healthcare, people left waiting while they're in a lot of pain, people terrified that the condition they've got isn't being looked at, people desperate for attention from staff who just haven't got the time to come around and see every patient. This is what's driving a lack of safety and security. And I think it's a broader issue in our society where instead of solving problems so people don't get riled up, we bring in security so that when they do, we can then have a go at them and blame them for the situation. If there is enough money to pay for security guards in hospitals, we need to stop spending it on security guards in hospitals, and we need to start spending it on having enough nurses, having enough doctors, and giving them a wage that is actually worthy of the incredibly difficult and not even slightly complacent job that they do. Isn't it, Sid? See you next week. Increasingly, the mainstream media is terrible at informing the public of what is really going on. I'm only able to make these videos because people are generous enough to sponsor me making them, and if you're able to be a part of that, I would hugely appreciate it. It can cost as little as $1 a month, and you'll get loads of fun bonus content and lots of extras from me and my undying gratitude. I also massively appreciate it if you're able to like, share these videos and let people out there know what's going on.